My name is Bob Frank, and I'm currently the Chief Financial Officer at Weirton Medical Center. I started at Weirton Medical Center in January of 2012. The hospital had been going through a number of years of losses, and when I started, I did a quick assessment and realized the revenue cycle was broken. I had known Dan Theory and Revenue Cycle Solutions from previous work at Jefferson Regional Medical Centers. A couple of things we came to realize very quickly was we had some cash backed up in coding and in the accounts receivable. We also had a situation where our charges were lower than our rate schedules, and so we immediately started on a strategic pricing assessment. We also looked at patient financial clearance policy. One of the big issues that we had was that at registration, folks were not being challenged if they were self-pay or medical assistance or looking at copays and collections, copays and deductibles. They weren't being challenged and asked to provide funding for that. In terms of the strategic pricing analysis, we quickly were able to raise rates on probably about 319 various charges and services, and that helped to increase our cash. We went from collecting about $5.1 million a month to over $6 million a month. Our days in revenue went from 57 to 49. We were able to institute, I guess, the beginnings of a patient financial clearance policy, and also then to put in place some services where we were able to collect dollars up front. Probably about a year or so later, we were doubling our upfront collections. And from a contracts perspective, Dan and his team, they assessed that we were losing or had the opportunity to gain significantly. So they provided a lot of the background that our executives used in terms of negotiating a contract, a very lucrative contract with a major insurer in the region. It was very apparent after a few months that things were starting to change. We got coding moving. We were able to initiate some strategic pricing increases right off the bat, which provided a boost in cash flow. So the turn started to occur very rapidly. And by the time that they left in June of 2012, we were well on our ways with having done a lot of things already, but also they provided us with some roadmaps and a game plan for going forward on our end. With Weirton Medical Center, they had gone through a number of different consultants coming in and taking a look at revenue cycle over the years. And nobody was actually able to solve it until Revenue Cycle Solutions came down. Dan and the folks were great in coming in, explaining to the folks in the billing department why they were there, what they were doing. They were providing interim management services until we could hire a permanent revenue cycle director. They were looking at operations, so they explained to the staff why they were doing certain things, why they wanted them to do things in a certain way. They explained the problems that they discovered. So it was a very good relationship. The staff loved all the folks from Revenue Cycle Solutions.